If you are over 60 and you have been faithfully taking a calcium supplement every single day, maybe for years, maybe on doctor's orders, what I'm about to share with you may genuinely surprise you. Because according to a growing and increasingly consistent body of peer-reviewed medical research, taking calcium in pill form may not be protecting your bones the way you were told. In some cases, the research suggests it may actually be working against you. Now, I am not here to alarm you. I am here to give you the honest science, the kind that gets discussed in research institutions and specialist offices, but rarely makes its way into a routine 20-minute appointment. Because older adults deserve to understand not just what to take, but why it works, how the body actually absorbs and uses calcium, and what truly drives bone density after 60. And once you understand that, 5 natural strategies become obvious. Strategies backed by clinical evidence, affordable to implement, and far more effective than reaching for another pill bottle. I am Dr. Naira Stein. For many years, my focus has been on how the body ages, and more importantly, on what we can do to influence that process thoughtfully, safely, and with real science behind every recommendation. Bone health is one of the areas I feel most strongly about, because bone loss is one of the quietest and most consequential things happening inside the bodies of adults over 60. You do not feel it happening. You often do not know until something breaks. And by then, years of opportunity to intervene have already passed. I want to change that for you today. Stay with me through all 5 natural strategies, because the final one is the most underestimated intervention for bone density I have encountered in my clinical experience, and almost no one is talking about it. The truth about calcium pills and bone health after 60. Why calcium supplements alone are not enough. For decades, calcium supplementation was the default recommendation for bone health in older adults. The logic seems straightforward. Bones are made largely of calcium, bone loss increases with age, therefore take more calcium. But the human body, as it turns out, is not that simple. And the research that has emerged over the past 15 years has significantly complicated that picture. A landmark meta-analysis published in the British Medical Journal reviewed data from nearly 12,000 participants and found that calcium supplementation alone, without accompanying nutrients and lifestyle factors, produced only modest improvements in bone mineral density and did not significantly reduce fracture risk in older adults. More concerning, several large prospective studies, including data from the Women's Health Initiative, found associations between high-dose supplemental calcium intake and increased cardiovascular risk in postmenopausal women. The proposed mechanism involves calcium from supplements entering the bloodstream rapidly and in high concentrations, potentially depositing in arterial walls rather than being properly directed to bone tissue. This does not mean calcium is unimportant. Calcium is absolutely essential for bone health. What the research tells us is that the form in which you consume calcium, the nutrients that must accompany it, and the biological environment in which your bones operate are all as important as calcium itself, and in some cases, more important. Understanding this distinction is what separates a bone health strategy that actually works from one that merely feels like it should. What is actually happening to your bones after 60? Bone is not static tissue. It is a living, dynamic structure that undergoes a continuous process called bone remodeling. Old bone is broken down by cells called osteoclasts, and new bone is deposited by cells called osteoblasts. In youth, this process strongly favors bone formation. As we age, the balance shifts. After 60, bone resorption, the breaking down, begins to outpace bone formation in most adults, particularly in postmenopausal women, where the loss of estrogen removes a key regulator that had been restraining osteoclast activity. The result is a gradual but measurable decline in bone mineral density. Over years, this progression can move from the early stage called osteopenia into the more advanced stage called osteoporosis, where fracture risk becomes clinically significant. Hip fractures, vertebral compression fractures, and wrist fractures in older adults are not just painful and disruptive. They are associated with serious, long-term consequences for independence and quality of life. But here is what the research increasingly confirms. This progression is not inevitable, and it is not primarily a calcium deficiency problem. It is a multi-system problem that requires a multi-system response. The 5 natural strategies I am about to describe each address a distinct and scientifically validated component of bone health, and together they create conditions in which your bones can genuinely rebuild and strengthen, regardless of your age. The truth about calcium pills and bone health after 60. Why calcium supplements alone are not enough. For decades, calcium supplementation was the default recommendation for bone health in older adults. The logic seems straightforward. Bones are made largely of calcium, bone loss increases with age, therefore take more calcium. But the human body, as it turns out, is not that simple, and the research that has emerged over the past 15 years has significantly complicated that picture. A landmark meta-analysis published in the British Medical Journal reviewed data from nearly 12,000 participants and found that calcium supplementation alone, without accompanying nutrients and lifestyle factors, produced only modest improvements in bone mineral density and did not significantly reduce fracture risk in older adults. More concerning, several large prospective studies, including data from the Women's Health Initiative, found associations between high-dose supplemental calcium intake and increased cardiovascular risk in postmenopausal women. The proposed mechanism involves calcium from supplements entering the bloodstream rapidly and in high concentrations, potentially depositing in arterial walls rather than being properly directed to bone tissue. This does not mean calcium is unimportant. Calcium is absolutely essential for bone health. What the research tells us is that the form in which you consume calcium, the nutrients that must accompany it, and the biological environment in which your bones operate are all as important as calcium itself, and in some cases, more important. Understanding this distinction is what separates a bone health strategy that actually works from one that merely feels like it should. What is actually happening to your bones after 60? Bone is not static tissue. It is a living, dynamic structure that undergoes a continuous process called bone remodeling. Old bone is broken down by cells called osteoclasts, and new bone is deposited by cells called osteoblasts. In youth, this process strongly favors bone formation. As we age, the balance shifts. After 60, bone resorption, the breaking down, begins to outpace bone formation in most adults, particularly in postmenopausal women, where the loss of estrogen removes a key regulator that had been restraining osteoclast activity. The result is a gradual but measurable decline in bone mineral density. Over years, this progression can move from the early stage called osteopenia into the more advanced stage called osteoporosis, where fracture risk becomes clinically significant. Hip fractures, vertebral compression fractures, and wrist fractures in older adults are not just painful and disruptive. They are associated with serious long-term consequences for independence and quality of life. But here is what the research increasingly confirms. This progression is not inevitable, and it is not primarily a calcium deficiency problem. It is a multi-system problem that requires a multi-system response. The 5 natural strategies I am about to describe each address a distinct and scientifically validated component of bone health, and together they create conditions in which your bones can genuinely rebuild and strengthen, regardless of your age. How K2 activates bone-building proteins. Here is what vitamin K2 actually does. The body produces a protein called osteocalcin, which is manufactured by osteoblasts, your bone-building cells, and is essential for binding calcium to the bone matrix. Osteocalcin is the molecular mechanism through which calcium actually gets incorporated into bone tissue, but osteocalcin requires activation to function. It must undergo a biochemical modification called carboxylation before it can bind calcium, and the enzyme responsible for that carboxylation requires vitamin K2 to work. Without adequate vitamin K2, osteocalcin remains undercarboxylated, essentially inactive. The calcium you consume, whether from food or supplements, circulates in the blood but cannot be efficiently incorporated into bone. And here is the cardiovascular connection. That unanchored calcium does not simply disappear. Research published in the journal Atherosclerosis and other cardiovascular journals has found that inadequate vitamin K2 status is associated with greater arterial calcification, precisely the mechanism proposed to explain some of the cardiovascular concerns with high-dose calcium supplementation. Vitamin K2 does not just help build bone, it helps ensure calcium goes to bone rather than to blood vessels. A clinical trial published in the journal Osteoporosis International followed 244 postmenopausal women over 3 years. Those supplementing with MK7 vitamin K2 showed significantly less decline in bone mineral density at the lumbar spine and femoral neck compared to placebo, along with measurably lower levels of undercarboxylated osteocalcin, confirming that the K2 was actively improving the body's ability to use calcium for bone building. Natural food sources and how to use them. The richest natural source of vitamin K2 in the MK7 form is natto, a traditional Japanese fermented soybean preparation, which contains levels dramatically higher than any other food. Other meaningful sources include hard and soft aged cheeses, particularly Gouda and Brie, egg yolks from pasture-raised hens, and liver. For those who find dietary sources insufficient or unavailable, MK7 supplements derived from fermented chickpeas are widely available and well tolerated. Research suggests that 90 to 180 micrograms of MK7 daily produces measurable improvements in osteocalcin carboxylation. One important note: if you take warfarin or any other vitamin K antagonist blood thinner, speak with your physician before increasing K2 intake, as it may interact with your medication. Natural strategy 2: magnesium, the mineral that makes vitamin D and calcium actually work. The overlooked partner in bone mineralization. Ask most people what minerals are important for bone health, and they will say calcium, perhaps vitamin D. Very few will mention magnesium. And yet, magnesium is involved in more than 300 enzymatic reactions in the human body, including several that are directly and irreplaceably involved in bone formation, calcium regulation, and vitamin D metabolism. Without adequate magnesium, both calcium and vitamin D are significantly less effective at supporting bone health, a fact that has been confirmed repeatedly in the research literature, but remains poorly communicated at the clinical level. How magnesium supports bone density. Approximately 60% of the body's total magnesium is stored in bone tissue itself, where it contributes directly to the crystalline structure of bone mineral. Magnesium also activates the enzymes required to convert vitamin D into its active hormonal form, calcitriol. This matters enormously because vitamin D in its inactive form cannot regulate calcium absorption in the intestine. Many older adults who are supplementing with vitamin D but not seeing expected improvements in calcium absorption may simply be magnesium deficient. Their bodies lack the cofactor needed to activate what they are taking. A large cross-sectional study published in the American Journal of Clinical Nutrition examined bone mineral density data from more than 2,000 adults and found that higher dietary magnesium intake was significantly associated with greater bone mineral density at both the hip and spine in older men and women, independent of calcium and vitamin D intake. A separate clinical study found that postmenopausal women supplementing with magnesium for 2 years showed suppressed bone resorption and stabilized bone density compared to controls. The magnesium deficiency problem in older adults. Magnesium deficiency is remarkably common in older adults, for reasons that deserve attention. First, dietary magnesium intake tends to decline with age as overall food consumption decreases. Second, certain commonly prescribed medications, including proton pump inhibitors, diuretics, and some blood pressure medications, deplete magnesium. Third, the aging gut becomes less efficient at absorbing magnesium from food. The result is that many older adults who believe they are addressing their bone health with calcium and vitamin D are unknowingly undermining their own efforts through inadequate magnesium status. Rich dietary sources of magnesium include dark leafy greens, particularly spinach and Swiss chard, pumpkin seeds, almonds, black beans, avocado, and dark chocolate. For supplementation, magnesium glycinate and magnesium malate are the forms best tolerated by older adults, as magnesium oxide, the most commonly sold form, has poor absorption and frequently causes gastrointestinal discomfort. A general supplemental dose of 200 to 300 milligrams of elemental magnesium daily is well supported by the research for bone health benefit. Natural strategy 3: weight-bearing and resistance exercise, the most powerful bone-building signal the body knows. Why bone responds to mechanical stress. There is no supplement, no drug, and no dietary intervention that stimulates bone formation as directly and powerfully as mechanical loading. This is not opinion. It is one of the most consistently replicated findings in bone biology. When bone tissue is subjected to physical stress, the impact of steps, the strain of lifting, the load of body weight, it responds by increasing the activity of osteoblasts, the cells that build new bone. The biological principle at work is called Wolff's Law. Bone remodels in response to the stresses placed upon it. Load it and it strengthens. Remove the load and it deteriorates. This is why astronauts who spend time in zero gravity experience rapid and significant bone loss despite perfect nutrition. It is why bedbound patients lose bone density at a rate far exceeding any dietary deficiency. And it is why regular weight-bearing physical activity is pound for pound the most effective bone-building intervention available to any older adult. What types of exercise build bone? Not all exercise is equal for bone health. Swimming and cycling, while excellent for cardiovascular fitness and joint comfort, provide little bone-building stimulus because they are non-impact activities that do not load the skeleton meaningfully. The exercise types that most strongly drive osteoblast activity are weight-bearing aerobic activities: walking, hiking, dancing, stair climbing, and resistance training with weights or resistance bands. A meta-analysis published in the Journal of Bone and Mineral Research reviewed 40 randomized controlled trials and found that combined resistance and impact exercise produced the greatest improvements in bone mineral density at the hip and spine in postmenopausal women, the population at highest fracture risk. Crucially, the benefits were observed not only in women who began exercising earlier in life, but in women who began structured exercise programs in their 60s and 70s. It is genuinely not too late. For older adults beginning or returning to exercise, a practical and well-supported approach involves 3 to 4 sessions per week of resistance training targeting the major muscle groups, combined with daily weight-bearing activity, such as a 30-minute walk. Resistance training does not require a gym. Bodyweight exercises, modified squats, wall push-ups, step-ups, resistance band rows, performed consistently, produce measurable bone density improvements within 6 to 12 months. If balance or joint concerns make independent exercise feel uncertain, working with a physical therapist or exercise physiologist for an initial program design is an investment with returns that compound over years. The muscle-bone connection. There is a second reason resistance exercise is particularly important for bone health that rarely gets discussed: the role of muscle contraction forces. When a muscle contracts forcefully against resistance, it exerts pulling forces on the bone to which it is attached. These tensile forces are themselves a significant stimulus for bone formation. This means that building and maintaining muscle mass is not just about strength, balance, and fall prevention, though those benefits are enormous. It is also a direct mechanism for driving bone density. Sarcopenia, the age-related loss of muscle mass, and osteoporosis are not coincidental companions. They share a biological relationship, and addressing one supports the other. Natural Strategy 4. Dietary calcium from whole foods. Why the source changes everything. Food calcium versus supplement calcium. A critical distinction. I want to return to the calcium conversation, because calcium absolutely matters for bone health. The concern is not calcium itself, but how it is consumed. And the research now makes a compelling case that calcium consumed through whole foods behaves very differently in the body from calcium consumed as an isolated supplement. When you eat a calcium-rich food, a piece of aged cheese, a cup of plain yogurt, a handful of almonds, cooked kale, the calcium is released gradually through the digestive process and absorbed steadily over time. It arrives in the bloodstream in modest, manageable concentrations alongside other minerals, proteins, and compounds that influence how it is processed and distributed. The body's regulatory systems, particularly the hormones parathyroid hormone and calcitriol, can respond appropriately, directing calcium to where it is needed and managing any excess. A calcium supplement, by contrast, delivers a concentrated bolus of calcium that raises blood calcium levels abruptly. Several large prospective studies have raised the concern that this acute elevation may overwhelm the body's regulatory capacity in some older adults, potentially contributing to calcium deposition in soft tissue, including arterial walls. A meta-analysis published in the British Medical Journal involving nearly 12,000 participants found no significant reduction in hip fracture risk from calcium supplementation alone, while food-based calcium intake was associated with meaningfully better bone health outcomes. The best dietary sources of calcium for older adults. Dairy foods remain among the most calcium-dense options available. Plain, full-fat yogurt provides approximately 300 milligrams per cup. Sardines with bones offer around 350 milligrams per serving, and aged cheeses such as Parmesan and cheddar provide 200 to 300 milligrams per ounce. For those who prefer plant-based sources, cooked bok choy, broccoli rabe, collard greens, white beans, and almonds all contribute meaningful amounts. The key difference between plant sources and dairy is bioavailability. Certain plant foods contain compounds called oxalates and phytates that bind calcium and reduce its absorption. Spinach, for instance, is high in calcium on paper, but has poor bioavailability due to its oxalate content. Low oxalate greens, kale, bok choy, broccoli, and chard, provide much more absorbable calcium per serving. Bone-in fish, sardines, canned salmon with bones, are excellent, highly bioavailable sources that also provide omega-3 fatty acids with their own anti-inflammatory benefits for joint and bone health. A practical daily target for older adults from food sources alone is approximately 1,000 to 1,200 milligrams of calcium, distributed across meals throughout the day. The body absorbs calcium most efficiently in amounts of 500 milligrams or less at a time, which is another reason why the slow, distributed delivery from food sources outperforms a single large supplement dose. Natural Strategy 5. Vitamin D3. With sun exposure, the master regulator of bone calcium. Why vitamin D is not optional for bone health. If I had to identify the single most widespread and consequential nutritional deficiency in older adults with respect to bone health, it would be vitamin D, not calcium. Vitamin D. And the reason it belongs at the top of this list, not because it is the most novel or surprising, but because its deficiency is so common, so impactful, and yet so correctable, is that without adequate vitamin D, the body cannot absorb dietary calcium properly from the intestine, regardless of how much calcium you consume. Vitamin D functions not as a vitamin in the traditional sense, but as a steroid hormone that regulates the expression of over 200 genes throughout the body. In the context of bone health, its most critical function is the regulation of calcium absorption in the small intestine. When vitamin D levels are adequate, the intestine can absorb 60 to 80% of dietary calcium. When vitamin D is deficient, absorption drops to as low as 10 to 15%. This means that a person consuming a calcium-rich diet, but with inadequate vitamin D status, may be absorbing only a fraction of the calcium they believe they are taking in. The epidemic of vitamin D deficiency in older adults. Vitamin D deficiency in older adults is extraordinarily common and is driven by multiple converging factors. First, the skin's ability to synthesize vitamin D from sunlight exposure declines by approximately 75% between the ages of 20 and 70, meaning an older adult standing in the same amount of sunlight as a young adult produces dramatically less vitamin D. Second, older adults tend to spend less time outdoors and use more sun-protective clothing and sunscreen, both of which reduce UV exposure. Third, vitamin D is fat-soluble, and its absorption from food depends on adequate digestive fat absorption, which can be compromised in older adults with certain gastrointestinal conditions. Fourth, obesity increases vitamin D requirements because adipose tissue sequesters the vitamin, reducing its availability to other tissues. Research consistently finds that between 40 and 80% of older adults in northern climates have insufficient vitamin D levels by clinical standards, with many falling into the deficient range. The consequences extend well beyond bone health. Vitamin D deficiency is associated with muscle weakness, increased fall risk, immune dysfunction, and cardiovascular risk. But for our purposes today, its role in bone health is both primary and non-negotiable. Sunlight, food, and supplementation. Getting D3 right. The most natural and physiologically appropriate way to maintain vitamin D is through direct skin exposure to midday sunlight, specifically UVB radiation, which is only present in sunlight at angles when the sun is high in the sky. For most adults in temperate climates, 10 to 30 minutes of direct midday sun exposure on the arms and legs, 3 to 4 times per week during warmer months, is sufficient to maintain adequate levels. This should be direct exposure without sunscreen, though avoiding prolonged or burning exposure remains important. For those in northern latitudes, sunlight-based production is essentially impossible during winter months, regardless of time outdoors, making dietary and supplemental sources essential during that period. Dietary sources of vitamin D3, the more bioactive form, include fatty fish such as salmon, mackerel, and sardines, egg yolks, and liver. Most people, however, cannot realistically meet their vitamin D requirements through food alone, particularly in winter or in northern regions. For supplementation, vitamin D3, cholecalciferol, is consistently shown to be more effective than D2 at raising and maintaining blood levels of the active form. Research supports a daily supplemental dose of 1,000 to 2,000 international units for most older adults to maintain sufficiency, though individuals who begin with a significant deficiency often require higher doses under physician supervision. The most important practical step is to get your vitamin D level measured through a simple blood test, the 25-hydroxy vitamin D test, and use that result to guide your supplementation rather than assuming a standard dose will be appropriate for your individual baseline. A target blood level of between 40 and 60 nanograms per milliliter is widely supported by the bone health literature as optimal for calcium absorption and bone density maintenance. The synergy between vitamin D3 and vitamin K2, which we discussed in Strategy 1, deserves re-emphasis here. Vitamin D3 increases the body's production of calcium-binding proteins, including osteocalcin. Vitamin K2 activates those proteins so they function correctly. The two work together in a relationship of mutual dependence, and many bone health researchers now argue that they should almost never be considered separately. Why these 5 strategies work as a system? What makes the difference between bone health strategies that produce measurable results and those that do not is rarely any single intervention. It is the combination. Vitamin K2 ensures that calcium is directed to bone rather than soft tissue. Magnesium activates vitamin D and participates directly in bone mineral structure. Weight-bearing exercise provides the mechanical stimulus that tells the body to build and maintain bone density. Dietary calcium delivers the mineral in a bioavailable, physiologically appropriate form. And vitamin D3 opens the door for calcium absorption to occur in the first place. These 5 are not alternatives to choose between. They are components of a coherent system, each addressing a different bottleneck in the pathway from calcium consumption to actual bone formation. The most important practical step you can take today is to get a bone density scan if you have not had one recently, and to ask your physician to check your vitamin D and magnesium levels through blood testing. Many people discover they are significantly deficient in one or both without any obvious symptoms, and knowing your baseline is the starting point for any intelligent strategy. Knowledge is not a luxury in this area. It is the foundation. For those currently taking calcium supplements, please do not stop abruptly without speaking with your doctor, particularly if you have been prescribed them following a bone density diagnosis. The point of this video is not that calcium supplements are harmful for everyone. It is that they are far less effective as a standalone strategy than they are commonly assumed to be, and that the 5 natural strategies described here address aspects of bone health that no supplement alone can replicate. Many people who add these strategies find that their doctor is willing to reduce or reconsider supplemental calcium as their overall bone health picture improves. I want to close with something I have come to believe very firmly after years of working in this field. We live in a culture that treats bone loss as one of the inevitabilities of aging, something that happens to older adults, something to be monitored and managed, but not truly reversed. The research does not support that resignation. Bone tissue is alive. It remodels continuously. It responds to what you eat, to how you move, to the nutrients you provide, and to the biological environment you create through your daily choices. Adults in their 70s and 80s who begin resistance exercise programs see measurable improvements in bone density. Adults who correct vitamin D and K2 deficiencies slow and sometimes reverse documented bone loss. The biology is real, and it is responsive at any age. You do not need to feel fragile because of a number on a bone scan report. You need a strategy, one grounded in real science, built around the way your body actually works, and pursued with a consistency that allows biology to respond. That is what I want for every person who watches this channel. Not fear, not dependency on a supplement bottle, but genuine understanding and a clear path forward. Your bones have supported you through every decade of your life. With the right knowledge and the right habits, you can support them in return for every decade ahead. I hope today gave you a meaningful beginning. Take care of yourself. You have absolutely earned it.